Good evening. I'd like to call the May 6th meeting of the Ashland Board of Health to order. The first thing on our agenda is citizen participation. Do we have any citizen participation? Doesn't seem like we have any. Oh. I'm sorry. All right, so you'll have to mute. Are you all muted? Nope, it's coming out of yours. You have to turn the volume down. You have to turn your volume all the way to 0. Oh, you know what? I wonder if it's that computer up there. Okay.
Test. Why is it?
Can you just shut it off?
Test. Okay, now we're good.
All right, let's try that again. Good evening. I'd like to call the May 6th meeting of the Ashland Board of Health to order. The first thing on the agenda is citizen participation. Do we have any citizen participation? No? Wait, Mark, can you unmute? Go ahead, Mark.
Can you hear me?
Yes, we can hear you, Mark. Go ahead.
Okay, thank you. Okay, good evening. Dr. Sony, 119 Main Street. It's been a pretty good while since I've been participating here, but I would like to ask through the chair if I can ask the what's his name? The health director, a question.
Please go ahead.
Okay, knowing that town meeting is coming up tomorrow night, and we have a future of people again graduate from college in the medicine science field. Does the Board of Health director know any new medical futures that are coming out now within the next year, 2 years?
Mr. DeSoni, are you asking if some people are graduating? Is that your question?
Well, I know that the state college is, well, this is May, so they'll be graduating soon, within the next couple of months. I was just wondering if any of the science, technology, technical, biological stuff that's new in the pipeline that's coming down on the road, is there anything new that's that is in the office now that can be looked at when they graduate and be looking for work?
So, Mr. DeSoni, only thing I'm aware, right? I mean, I am not aware about science and technology folks, but for public health folks, right? They do reach out to us, here and there for asking for internships or guidance, in public health field. So those I regularly communicate with, but not with science and technology people,
And what about the medical science field?
Just public health, because I mean, at least our department, we are from public health. So I did had an email from somebody in Ashland, a resident, last week as well, asking for information, or guidance in public health field. So that's what we deal with.
Okay, reason why I'm asking that was what came out in the new Ashland local pages was this book. Okay? And in the book was a page for the Board of Health.
That is correct, yes. Mhm.
So I was just reading it and going through it because other than has a Ashland public health nurse, Anthony Shell says, and involved in health education for many years. And what's the educational background that could be for public health services?
So that's an article that, we every 3 months or something, we do send out articles related to public health, in various social media, both print and online, so that's what we do. And this was the article written by our public health nurse, Anne.
Okay, and I'll try to ask it and Ed at the same time. What are the experiences that would attract Board of Health to have more of an experienced cast members to help the town?
Yeah, can you repeat that, please, one more time,
Programs of prevention of illness and frailty, preservation of strength and independence and engagement with the larger community. What experience can fill that field?
If I'm getting it right, it's just the experience. She have 40 plus years of nursing experience, so based on that, that's what, and she gives, kind of seminars also at our senior center, and this was one of the seminars as well, that she did, I guess last month at the community center.
And to help out the Asian community citizens, how unique can they help a senior and their health issues through the Board of Health?
So Mark, our public health nurse goes up to the senior center quite often. She helps with blood pressures, helps with medication. If people don't understand some of their medication, she sits with them. She helps with clinics, flu clinics, different things like that. Anything that's community related is what the community health nurse does. She can even do home visits if people need that for a particular reason.
Okay, and what senior center, they also have the what I think called the Clocker Cafe. Yes or no?
I'm not aware of it,
That's about the Alzheimer's memory care, no?
They do have a program up there, but.
I know that
Right.
they did at one point.
Yeah. Mark, we need to move on. We have a hearing, if that's all you have.
Well, I was just saying the small office help that's at the Board of Health, senior citizens population is growing. Let's go and see how they can keep up. Once they do have to keep up, once we get populations with more 40Bs coming in. That's it, done.
All right, thank
Thank
you,
you.
Mark. So the next thing on our agenda is the Lifeguard waiver request from the Asher, 100 Chestnut Street. Do we have anybody on for that? Can you unmute him?
Hi, yes, good evening. Todd McDowell from Based on Development. How are you?
Good, how are you? Go ahead.
Good. I apologize that I couldn't be there in person. Just having 4 kids, it was a little difficult to get everybody covered for this evening. So I apologize that I'm not there in person. We actually asked for a waiver regarding the lifeguard requirement. We know this is a kind of a city by city or town by town regulation. And one of the reasons we're requesting that is due to the kind of the systems and cameras and tracking information we've kind of put in place at the Asher. We are just applying for our first pool opening permit. Just to give you a little bit of detail, we're 174 units. We just got a C of O for the first 86 units and expect the C of O sometime in the near future for the remaining 88 units. The pool is in between the two buildings, which it sits in a courtyard. It's surrounded by a 6-foot fence. We have a vast number of security cameras around the perimeter of the outside of the site, as well as in the courtyard. We have the security fences are used to access a system called Latch. And on each Latch system, there's actually an individual camera. So it has a video of anyone going in or out. And it also tracks the fob when you put the fob or phone to the pad to get access. So there's a variety of security systems, and Latch system also allows us to restrict access. So it won't open after, say, if the cutoff time is 8 o'clock, 8 p.m., no pool access, or before 7 a.m., no access to the pool area. That said, we have on-site staff, leasing staff, as well as maintenance staff. They're not there 24 hours, but they are there for the majority of the time the pool area is opened. One of the other things is the courtyard's well lit, and it is surrounded by windows. We find actually the best security system typically is other residents as well, because if somebody's out there making noise or doing something they shouldn't be, we are very quick to hear from them, and our management company is very much on top of handling that situation. Plus, you have record video and digitally of anyone who is violating pool rules to warn them and then enforce them as that happens. We use a third-party company, High Sierra, to manage the pool, to keep it chemically in balance and testing. The pool is 4.5 feet deep. Originally, we were planning on making it 5, but as we got building it, we decided to only make it 4.5 feet deep, just to make it a little safer and less. There's no really reason to make it 5 feet, we thought. So we have a variety of these security systems, camera systems, and management staff on site that we were looking to request a waiver for the pool lifeguard requirement.
So just a few questions from the board. I have a few, I'm sure other board members. What's going to happen if a resident, if you have a lockout, during, like, let's say 10 p.m. to 5 a.m. about jumping over the fence? It's a 6-foot high fence. Sure, anyone can get over anything if they're determined. So the 6-foot high fence is the first deterrent. If somebody does get a ladder or jump the fence somehow, there will be cameras of that person. Now, getting them out, my guess is we'd have residents calling our management, and we have, right now we don't have management that's going to live on site. We do have management that lives over about 7-8 minutes away at the Buckley in Framingham that could usually is on call, that could get there relatively quickly. But usually it's self-reporting, and if someone does it, they'll get in trouble. And either I'm not sure the whole process for enforcement, whether it's fines, and then later, if it happens multiple times, eviction due to non-compliance with rules. But that's a whole housing matter. Okay, and then one other thing, which I'm going to ask you to do also, could you reach out to the police and fire chiefs? A lot of the other apartment complexes in town, what they've done is they've given them a list of the police officer and firefighters' door access cards. So in the event they have to get into those buildings immediately, or have some kind of access code for them to get in.
We actually have that, because we have the same system on the entire building. So they have access to basically every door on the entire site.
Okay.
This latch system works the same as every other front door, back door, every door in the building.
Okay, so they'll be able to get in whenever they need to.
Yes.
Okay. Does any other board members have any questions?
Yeah,
Yeah.
I will. Okay. Hi, Todd. I
Good evening.
I have a question about, good evening, about signage. And actually, I was over there, I was just taking a walk over the weekend. It looked nice, just from the, as far as I could get in to see the pool. I didn't even know this was on the agenda, actually. I just happened to be in the area. So, but what is the plan for signage? Because as I'm reading the state codes, if no lifeguards are required by the Board of Health, warning or no lifeguards are on duty. I didn't read that in the waiver or variance request that you had sent.
We certainly will put that up if we're granted the waiver to meet all signage requirements. We've got a signage company we're utilizing now that they make signage for everything. We've worked with the building department, and the fire department has requested additional signage in various locations. That's not been a problem at all. We're happy to put up any additional signage that you might request or require. That code or beyond code, we're fine with that.
Okay, so I would recommend that you just take another look at the state regulations, because as I'm reading it here, warning, no lifeguard on duty is one of them.
Yep.
Another one that should be visible is children under age 16 should not use a swimming pool without an adult in attendance.
Yeah, we have a couple other pools that we do this with, and we don't have lifeguards, and we have all the signage. So I'll also double check to see if there's additional signage. Sometimes insurance also requires us to put stuff beyond the state code as well. So I think include it with our insurance as well.
And what about emergency phone number posted?
That we can add a posted. We have a phone that has a phone number on the pool side, and we can definitely post like a 911 number. You're saying, or
Yep,
Yes.
exactly.
all right.
Okay,
Dr. J, just to clarify, that's a requirement, so every pool need to have a number, that. that-
Okay, I'm sure that's there then if it's required.
Yes.
If not, I'll double check.
thanks.
Anybody else have any questions? Barbara?
I think you kind of answered my question. Because I was just like, if there's a time that there's not going to be a lifeguard, it's no time. There'll never be a lifeguard.
There'll never
So-
be a lifeguard. That's what they're
so-
asking for.
Yeah, so now my question will be, is any of your staff like maybe CPR certified, just in case of emergency? Not at all times, but in case somebody
While they're there.
drowns or, yes, I know you got cameras looking at them, but is somebody going to physically go and give them assistance until?
I don't know the answer to that. I know I am, but I'm not going to be there every day. I will find out if any of our maintenance or site staff is CPR satisfied, and I can let the board know via email.
You mentioned that there would be staff on site for most of, but not all of the pool hours. Can you elaborate on that?
Typically, we have leasing staff there from 9 to 5. Our hours may vary slightly, might be 8:30 to 4:30, depending on a certain particular day. And then we have management staff, but we always have on-call maintenance staff. So if there is any kind of maintenance emergency, there's always a maintenance person on call that needs to be there within a certain amount of time if there's a lockout or any other kind of issue in a unit. So there would be that kind of on-call status as well for maintenance for the pool.
So what are the pool hours going to be?
I think I'm trying to recall exactly what I put in the application. I apologize. I believe it was, sorry, I have it right here. Just pulling it up. Usually it's the pool closes around sunset time. So in the summer hours, it might close later around 8:30. In the fall or later summer, it might close closer to 7:38. We typically don't want people out there swimming at night. But the exact hours, I apologize, I don't have. If there is a limit, we may have put it on the application 10 o'clock. I don't anticipate we would actually have those hours just because of resident noise. The pool is literally right in between two of the buildings, so we are cautious about having late hours or too early of hours because of pool noise.
So Raj, I have a question for you. If we grant this waiver, because this is really will be our only apartment complex like this that we would be granting this waiver to, if we encounter any issues or problems, is that something we can revoke until for further evaluation?
Absolutely, Chief, so I guess if board is gonna give them a variance, right, or waiver, if there is anything, against it, then we can definitely revoke it,
Just Todd, this is a new territory for us. The only one we've ever granted is an over 55 development.
Understood, and I assume that if we violate some regulations, as anything else, something could be revoked.
Anybody else have any questions?
I have some questions about the latch. Is it an app?
So there's a couple ways you can use it. It is an app on a phone, which you can just put your phone with Bluetooth and it will unlock it with your code. But it also has a keypad. So if you touch it and you have a 6-digit keypad, you can enter that manually for your own. It's an individual number that you'd have to memorize.
So that number can be given to anybody, not necessarily residents?
You could potentially give it to somebody else, but though they would be on camera and you would be liable if you're giving out your access code, just as kind of giving out a house key to somebody. But this would actually track them with a camera.
And then in terms of, you said that there's like posted hours. Is there somebody who's going to be going around, say, let's say that hours end at like 6 p.m. What happens at 6 p.m. when somebody has been there for several hours? Are they being kicked out by somebody?
So I guess technically we wouldn't have anyone there to escort them out of the pool area. If they left, they couldn't get back in. But if they were hanging out there till 9, 10 o'clock at night or some other time, that's when we'd see on camera that they're there. And the next day when our staff is back on site in the morning, there would be a conversation saying you're violating our community rules.
And the state, their guidelines were also talking about safety equipment, and I'm wondering, like, obviously the point of having a lifeguard is to have access to not only someone who can help render aid, but has some experience using like first aid kits and is CPR certified. So like what kind of access to safety equipment, like ring buoys, and would
There's a board with a back stretcher, the kind of hard stretcher. There's the buoys, a first aid kit, emergency phone. Trying to think of what else there is. I can't think off the top of my head. It's required. All that stuff's required at pools, public pools, semi-private pools. So we have all of that equipment ready to go.
That's all readily accessible by residents and not just like staff?
Yes.
Mr. Morris, yes, so those are the equipment we see, that it's available, when we do our inspections, And Mr. Todd, one thing I want to say right before the board takes the decision, right? So we do have a requirement for the pool water tested every 4 hours. So I'll recommend, if we can get somebody who's going to be testing the water certified, CPR and all that, that might be helpful, So.
Absolutely. In our other buildings, our maintenance staff is all tested. I think they tested every 2 hours on hot summer days, but they meet code regulation to do every 4 hours. So we've done it both ways. We've had a third-party tester, but we've also had our staff on site trained so they can make that testing as required.
Thank you.
Raj, can I just clarify? So I think that we're all seem to be in agreement that, I mean, I don't want to speak for anybody else, that we're comfortable with this. And if I'm misspeaking, you can definitely let me know. But that's what it seems like. So if there is a waiver, can you just be clear on what is the requirement that's being waived?
So, as I read the regulation, right, I mean, it does say that it's the Board of Health discretion, right, like, or the Board of Health have the authority that that if you decide, to have the lifeguard or not, so.
Right, so it's really not a matter of waiving anything, since that is not actually a written regulation at this point. Is that correct? If we were to waive a requirement, then that means that there's actually a requirement.
Dr. J,
Versus just a decision that we're making that this is
right,
reasonable.
Yeah, it's not clear, right, but like, that if we have anything beyond the state code, right, but in a typical situation, right, that there'll be a lifeguard, right, like, but again, it says it's the Board of Health's discretion, but you're right, like, it's not like you're waiving something here because it's not a requirement.
Right, I'm just wondering because we want this to be official, if we're doing this as usual, we're waiving a requirement, we're voting on that, is it necessary to waive something that isn't actually a requirement versus just giving our blessings?
True, and we might have to look back, right, how it happened for the lanterns, that because every 2 years we give them a waiver as well. So this came to our discussion in the office, right, like how that happened, we just have to look back,
Okay.
like, because we did give waiver to lanterns as well, right, like, and we do it every 2 years, so.
Mhm.
Would it be better to say that we just make a ruling as to whether or not we're going to require
Yes,
that there?
that'll be a good idea, so I mean, and again, I'm for it. I mean, this pool is only 4.5 feet, right? I guess the one at Chestnut Place is a way deeper pool, and I guess the board should look into that, like, then we should make it as a requirement, from Ashland side. Just if it is a deeper pool, then it's a bigger threat, so.
Mhm.
So do you want to make a motion?
Sure. In that case, if there's no more discussion, I will make a motion that the board not require a lifeguard for the property at,
100 Chestnut.
100 Chestnut.
A second.
Thank you, I appreciate it.
Any further discussion? All in favor?
Aye.
Aye.
Okay, that carries. You are all set. Hopefully you won't be in front of the board.
Yes, thank you for your time, I appreciate it.
Thanks.
Thank you.
Have a good night. Bye.
Perfect, yeah. Okay. All right, so the next thing on the agenda is the health director's report.
Thank you, Chief. So the first item is the Dollar Tree closure. As most of the board members know or public know, the Dollar Tree was closed on April 30th, given a complaint and the rodent infestation. I was at the store today, this afternoon, and I spoke to Mr. Rocky, who was in charge there. It seems that they're doing the repairs, and it'll be probably a couple of weeks before they'll be ready for reinspection to be reopened, so that's that. Sauce Supermarket had a similar problem, but they have complied. They have provided us with everything that we needed, and they have cleared the inspections since, so they are all set. Starbucks have applied to us what we called as TPSC, that's time as public health control. So what they're trying to do, they're going to have the carafe, right, where they can keep half and half and oat milk outside, right? So they have submitted us documentation for that. I can forward that to board, but I have reviewed it, and I spoke to the team this afternoon as well, So I guess we should be good to go on that. But we don't need a variance or anything from the board side. Why I put it here, I just wanted to bring it to board's attention in case you are in Starbucks and you see that, so they'll be doing that. Dr. J, go ahead, please.
So I'm assuming that Starbucks has not had cream and that sort of thing out yet.
So right now, sir, they are doing it. So what they do currently, that that half and half and oat milk that they do it in U.S. stores, right? They take temperature of the product every 1 hour and document it. Now, if the temperature goes over 41, they discard it.
Got it.
So with this TPHC, what we call as time as public health control, they won't be doing that procedure, So that's what it's again, this was a change in the MERS code that we at the state level adopted in 2018, 2019. Earlier, there was a requirement that this need to be under variance, right? That the board have to grant a variance, but it's not anymore, So, but how it's written in the merged food code that they still need to get it approved by the regulatory authority. In Ashland's case, it's the Board of Health, and they have submitted it to us, the procedures for this TPSC, and I have reviewed it, So we should be good to go. And I will forward it to the board as well, just to look at it. And if you have any questions, please let me know.
Raj, just before we go any further, can we just go back to Dollar Tree real quick?
Sure.
Have they supplied to you the food destruction documentation yet?
Chief, there was a call, I guess, yesterday, right, Laura? So they had a clarifying question, but they're gonna be providing it to us, So, and
So just so the board knows, when something like this happens and they have to dispose of all of the food that is in the store, they're required to submit to the health director an actual destruction report from a company to show that that food was disposed of.
yes, so again, there was a call, So we should have it, and I'll forward it to the board once we have it, So with the housing cases, these are two, another, not exactly housing, these are the issues at the dumpster at both 28 Concord Street as well as 56 Concord Street. These both are complaint-based cases that came to our attention. Both was issued order to correct letters, and 56 Concord Street, this is an apartment unit, they have complied with our order to correct letter. 28 Concord Street, I have one citation of $100, issued for non-compliance, and I'll be following up on this again this week, just to see where we are. But I did meet the owner of the building before my travel. With Boston Marathon, we didn't have any event or issues with the shelters we have set up. Thanks to the board members, Dr. Jade, Barbara was there, I appreciate that. With the OpenGov permitting software from the last time, we do have our permitting software ready. The team at OpenGov have also put the inspectional software ready now that we'll be testing, and we have some training scheduled for them, to get going on the software. I guess we have one, Laura and myself have one on next week, right? But we have a meeting tomorrow as well, but that's with other departments. So we should be rolling that soon, maybe anticipated maybe in a month's time or even before.
Question, Raj. So is that only for permitting, the OpenGov, or is that are there other functions that serves as well?
So yes, both permitting as well as inspectional software, So through that, I guess we have a good number of permits. I guess we issue different kind of permits, like to the count of 15 or 16 permits that we do it from that. So we did develop one permitting software with them, and then some of the other ones, we'll get it from the other communities, right? Mm-hmm. And then me and Laura will work if we have to edit some stuff in. They have already had, right, like in their database, they have softwares made for different permits. Now, I just want to clarify, like, are different applications, right, that we need to put it into the software to generate those permits, right?
So beyond like permitting or inspections, like stuff like accounting and other municipal functions, that, because I haven't looked into it, but I'm curious, is it more than just inspections, and is it a larger thing? But you're just using it obviously for.
That's true, so the whole town, whole functioning of the town is gonna be going on OpenGov.
Oh,
right?
yeah.
It's
That's what I was
probably gonna start with the building department, right? Their functioning, and then it'll be Board of Health, and then it'll be everybody else. For right now, I guess it's all town departments who are working with the OpenGov to develop whatever they need.
Got it.
And once we get going, it's not gonna, everybody's not gonna get on it at one time, but it'll be like kind of a phased approach, that few departments are gonna get, and, once we have success, and then the other ones are gonna roll out. So it's not gonna be one time, or everybody's not gonna get on it at one time, So, but
Right.
the process is going on with all other departments, right? And they're developing whatever they need, like, the town clerk's department needs permitting software for dog licensing, right? So they have a different software, not the different software, or, their stuff, they're putting it
Yeah.
in. So the community members, the residents will be able to apply online, once we have it going, and they'll be able
Yeah.
to make the payments online as well.
And so for health department, what is the goal to have this working 100% by when?
Dr. J, it'll be a little difficult to say that right now, right? Like, because the number of permits we issue is a lot,
Yeah.
We have different kind of permits, So we did develop with the team's help, right? Or they developed it for us, what we call as our main food permit application, right? But then we have different ones, right? We have a plan review application, we have a application for food trucks, residential kitchens, right? Temporary events, right? So farmers market, So we have a lot of different permits that we eventually will get into, everything, but I'm not sure on the timeline, The
Yeah.
goal should be like before our new cycle kicks in, right? Like by end of the year, right? We have our permits expire. Hopefully by that time, we have everything in place, or maybe before, But with the number of permits we issue, right? Like we have not gone to septic permits, haulers, installers, right? So we have to work on those. to
Right, so
get-
you need
get
to
them going.
basically incorporate your permitting system into that
Right,
program, upload stuff,
right. We have to
questions.
bring the applications in, so
Yeah.
for the residents to apply online,
Right,
right?
so you're gonna just kind of pick away at doing that until they're all in.
Right, like another example for animal permits, right, that we have to put those application in the system so folks can apply online,
Right.
So, but I guess it's gonna be a process, given the volume of stuff we do, right, the number of permits we issue, everything those physical applications need to be put into the software for that to be functioning,
Yep.
But it'll be slowly, but, once we launch the first one and see it happening, so, and then we plan to next year, like, with end of this permitting cycle, right? All of our permits expire December 31st, right? Before that, couple of months, we start our process of, renewing the permit. Hopefully, we'll be able to renew the permits online.
That'd be nice.
Right, yes.
Yeah.
I mean, very good software, I have worked with it before, but it's just the challenge of getting on it and get going, so for right now.
Thanks.
Thank you. And just with the disease investigation, last time in the board meeting, we have one Campylobacter case that we have closed since. And other than that, we have like 3 to 4 active TB cases that we are working on. That's all I have, but I'm open to any questions from the board.
Anybody? All right, so the next thing on our agenda is the consent agenda, to review and approve the fiscal year 25 year-to-date budget report, and review and approve the meeting minutes of April 15th, 2025. Do I have a motion?
I'll second that.
Okay, any discussion on either item? All in favor?
Aye.
Okay, it's unanimous. The next thing is discuss future agenda items, external grease trap waiver, 12 Oak Tree Lane.
Chief, both the items are still pending. Again, waiting from DPW on the grease tape waivers, and 12 Oak Tree Lane is still pending with conservation. You know, once we have that, we'll bring them on board, you know, so.
All right, so, anybody have any new business or anything? No? So our next meeting date is going to be June 3rd. And if that, no one has anything, I will look for a motion to adjourn. Anybody?
I so move.
And I will second it. All in favor?
Aye.
Aye. Good night.
Aye.
Thank you, everyone. Thanks.